The birth of a new life is often a refreshing, joyous occasion. We celebrate life because it is the beginning of a chapter and often a representation of the unity of love. Though happiness is usually expected following childbirth, it is important to note that not everyone reacts to childbirth in the same manner. The case of mothers suffering from postpartum depression is one of those special, yet not so uncommon cases where the feelings following childbirth do not comply with the societal expectations of celebratory emotions. Postpartum depression is a subtype of major depressive disorder. The only thing that sets it apart is its onset period and context following childbirth. It's also different from baby blues because it lasts longer and is harder to alleviate. Some of the symptoms include loss of pleasure, low mood, forgetfulness, irritability, anxiety, and lower functioning. The most striking feature is probably the absence of that closeness with a newborn child that is usually present in new moms. Though treatment options are available, by taking some extra steps to look after yourself or your loved one who is going through this particular journey of life, you can prevent or reduce the likelihood of postpartum depression onset.
So, what are some of the tangible steps we can take to help prevent this? The prevention includes two parts: prenatal and postnatal. The prenatal period is the time between conception and birth. During this time, many studies suggest that maintaining a healthy, active lifestyle, being aware of your psychopathologic history, and trying to stay positive can assist in reducing chances of depressive symptoms following childbirth. A mother's confidence can be encouraged by learning about pregnancy and parenting. Having peer support workers or midwife and doula services throughout the path of pregnancy has also been shown to reduce anxiety and boost self-esteem. Families can also support expectant mothers by providing emotional support and sharing the burden of role transition, such as doing chores and accompanying the mother to care support classes. Other ways to prevent postpartum depression are for mothers at the postnatal stage, the time following birth. Studies encourage mothers to continue attending support classes and to maintain healthy lifestyles. What can peer support workers do to help with postpartum depression? Peer support workers can lead support groups, visit these mothers at their home to gain more information of their home lives, call the mothers and be available when needed, and provide the mothers and their families with available resources. Mothers should also be informed on the availability of services that can help with postnatal anxiety and depression.
Though it seems like these steps are simple and manageable, it's important to note that postpartum depression is highly underdiagnosed. Why is that? A lot of that can be accounted for by social stigma, a negative perception of a particular state or quality. As stated above, we have an ideal image of what early motherhood should be, a time filled with happiness, love, and joy. But with postpartum depression, this image can be farther from the truth. Society seems unable to accept the fact that sometimes feelings following childbirth can be less than merry. This can cause mothers to hide their symptoms and be hesitant or unwilling to seek for help. To learn more about how to address the issue of stigma through accessible assessment tools and understand how to help guide mothers with postpartum depression on the road to recovery, attend our workshop, Reclaiming Motherhood, where we will provide full details in a non-clinical setting for peer support workers and families.